So I'm Dr. Belardo, and I've been in private practice since 1992 after finishing my residency in ophthalmology at Columbia University in New York, and then went on to do a cornea fellowship in upstate New York in Rochester. And in my practice, I've been focused primarily on oculoplastics, but also a fair amount of cataracts and refractive surgery. So I've come across many challenges along the way and have seen the evolution of implants and technology, and I'm very excited to be here to share some of the new innovations that I've learned recently. I've been around the cornea, area for so long that I've also seen quite a few patients with it, but in the past we had very limited knowledge of the actual understanding of what was going on with these patients. We just saw that the conjunctiva was kind of overlapping the lid, and so what we did was we removed tissue, and we actually made things worse because we were removing tissue and tightening and actually fixating the little fornix in the reservoir, making it smaller. So many times we might have made it look cosmetically better, but in actuality we were making the problem worse and we were not making it any better. So when I learned about mechanical approaches such as the amniotic membrane and using the biologics to actually repair and create a new reservoir, that just revolutionized my whole approach to it. And the results with our patients is just from day and night. We now actually have an answer to a problem that's been around for a long time, and we just didn't understand well enough how to manage that problem. So I differentiate mechanical dry eye from just regular dry eye by looking at my examination. You look at the patient's eye and you see the actual, basically, excess tissue reaching over the lid of the patient's eye, and you actually can see this as a real obstruction of the flow of the tears, obstruction of the tear actually being able to be evacuated by the actual pump of the eye. And so when you see this, you actually understand that this is a mechanical problem. But for a long time, we've been treating these just symptomatically. Oh, they have teary eyes, they have irritation. And we didn't fully understand the mechanics of it. So we treat mechanical dry eye by a very simple approach. We first diagnose the condition. We understand, and the patient understands where we're coming from, what's happening. They look at the pictures, they understand what the anatomy is all about. And once we have that, then we're able to do a 15-minute procedure and basically remove the abnormal tissue and recreate the reservoir that is missing in the eye by placing a cryopreserved amniotic membrane. Once we do this, the cryopreserved amniotic membrane not only gives us the reestablishment of a new reservoir, but it actually decreases the inflammation in the eye, which the eye had been irritated for so long from just the chronic issues of dealing with dry eye, and all the therapy, of course, that sometimes goes into these patients can actually be an irritant at times as well. So once we're able to get them off all these medications and get them back into a status of balance, they are just so appreciative of these conditions and how we're able to approach them today. Well, the process of discovering mechanical dry eye has been an evolution over many, many years. So from the very, very inception, it was something that we kind of saw but really did not understand until recently when we actually had a solution for it. And using the cryopreserved amniotic membrane has just revolutionized our understanding of it, as well as the option for our patients to recreate that reservoir and give them back the comfort and give them back their tear film, which they have been suffering from for so long. So we're very excited about this. We offer this to our patients. Our patients are very happy, and of course, as a surgeon, it is a very gratifying procedure to do. Sure, I had a patient that recently had seen several other doctors and had gone to different specialists, and they all basically gave her another different drop, from steroid drops to the latest in all the new Xiidra, Restasis, and artificial tears, plugs. And still the patient was suffering that, hey, look, my lids are still irritated. They're red because my tears keep flowing out. So on one hand, I have all these symptoms, and on the other hand, now it's gotten worse. So one of the things that we're able to do for these patients is once we reestablish that new reservoir for these patients, we're able to get them off of all these medications and get them off the plugs. And they are so appreciative because now they feel like they're back to a normal situation and they feel so relieved. And many of them actually feel like why didn't I do this earlier? And unfortunately, it's still, the message has to get out to all the doctors. This is a condition that we can treat. And I really want to be one of the people that promotes that message, and I share it with other doctors. And always, always, always keep the patient's interest as number one by keeping ourselves informed of the latest technology. I think the most important message to all my peers and my patients is to recognize that discovering the mechanical dry eye has been and will be in the forefront of dealing with all the baby boomers that are over 60 that have this condition, because it's so prevalent among that group. And if we're able to understand what's going on, this will be a wonderful adjunct for all the surgeons and for our patients to discover the dry eye. I mean, we have a dry eye solution that we've never had before. So I'm excited to be a part of this, and I look forward to helping others and other doctors and other patients.